While federal sentencing guidelines for crack cocaine were amended by the United States Sentencing Commission in 2007, the legislatively mandatory penalties remain in effect. Because of disparities in cocaine sentencing laws, that is, the difference in sentencing between crack and powder cocaine, African Americans serve almost as much time in federal prison for a drug offense as whites do for violent offenses. Drug policy is inseparably linked to foreign policy. As a recent article in The Guardian noted, Afghanistan's $3.7 billion opium industry provides 90% of the world's supply. As the country edges closer to becoming a narco state, the international community is divided over a solution. The drug market is a world market, not regional, national, nor in this case, Afghan, says Barnett Rubin. The problem starts with demand, and an industry that supplies that demand and seek locations for production. And because it is illegal, it seeks places where the cost of illegality is lowest, the most lawless parts of the world. And that right now means Afghanistan. And if it were not Afghanistan, it would simply be someplace else. We could continue to explore the intersection of drug policy to other sectors of public policy, including health and education, but frankly, neither one of those is material and could in fact be speeches by themselves. What we are inevitably led to, however, are the issues of prevention and treatment. Some 500,000 people are currently imprisoned for possession or sale of drugs. Many more are incarcerated for drug-related offenses committed to secure drugs of money, to purchase drugs, or under the influence of drugs. 20% incarcerated in state prison report that the motivation for their offense as the need to fund a drug habit, and more than half suffer from a drug addiction. In 1991, 1 in 3 inmates who used drugs before incarceration were receiving treatment. In 2004, that number had declined to 1 in 7. Drug treatment is far more cost-effective than mandatory sentencing. A RAND study concluded that $1 million spent on incarceration would reduce drug consumption nationally by 13 kilograms. Spending the same amount on treatment would result in a reduction of consumption by 100 kilograms. Treatment is also significantly reduces recidivism. In New York State's Stay Out of Prison program, 27% of graduates are rearrested after parole, compared with 40% of those who received no treatment or only counseling. Rates for women were even better than those for men. A meta-study of 53 studies in 24 states, mostly completed between 1994 to 1999, found that ex-offenders who underwent treatment experienced a reduction in the use of alcohol and other drugs, improved employment status, decreases in physical health problems and hospitalizations, and other family problems. The longer the stay, coerced or otherwise, the better the outcome. In 2004, I helped lead the effort to place a referendum on the ballot in Cook County, Illinois. And it was a simple referendum that simply read, shall the Illinois state government provide adequate funding for comprehensive and appropriate substance abuse treatment for any Illinois state resident requesting services from a licensed provider, community-based organization, or medical care facility within the state? The referendum was approved by a 4-to-1 margin. These conclusions are part of a powerful emerging consensus strongly supporting the rationale and need for the Second Chance Act, which after a 6-year campaign was signed into law by President Bush this fall. According to the Bureau of Justice statistics, more than 2/3 of released prisoners are rearrested within 3 years. These figures underline the current ineffectiveness of prison as a deterrent and as a reform. There is a shortage of vocational education and substance abuse programs in prison, and more than 100,000 prisoners are being released each year without any form of community correctional supervision. According to the U.S. Department of Justice, 62% of those released from state prison will be rearrested within 3 years, and 40% will be reincarcerated, including many for technical violation of parole. Almost 40% returned due to a new sentence. Ex-offenders that are truly interested in reintegrating back into community life, interested in finding employment and taking care of themselves and their families, locating housing, going to school, oftentimes have no place to go. There are very few second chances. What happens to a man or woman who cannot find an employer willing to give them a second chance, who are refused TANF benefits, who cannot receive subsidized housing, educational, or medical assistance? We have seen over and over and over again that they return to prison. Neighborhoods across the nation are absorbing the economic and social cost of reintegrating hundreds of thousands of ex-offenders back into society each year. In 1991, the Bureau of Justice reported that the cost of the justice system per resident was $299. In 1996, the Department of Justice reported that the cost of crime to victims rises to approximately $450 billion a year, or $1,800 per man, woman, and child. If we could find a way to seriously reduce crime, reduce recidivism, provide opportunities for these individuals to become self-sufficient, to learn a trade, develop a skill, go to school, get a job, then not only are we providing for them, but we are in reality helping all of America. And that's why I think the work that all of you are engaged in, the work that students who understand the differences between being where we are and where we need to go, the fact that so many of you have convened here this Saturday afternoon gives rise to hope. Hope that we can develop out of America a sane policy relating not only to other issues and problems, needs, hopes, and aspirations, but also relating to the way that we treat drugs. I am so pleased and delighted that I've had an opportunity to come and share these moments with you. I encourage you to stay engaged, stay involved, stay focused, and always believe that not only is change possible, but change is inevitable, and that life can become not only for each one of us, but for the millions of people who are disconnected, out of place, not experiencing real opportunity, that life can change for them too. The poet summed up what I've tried to say in just a few words when he said that life becomes for all of us whatever it is that we endeavor to make it. He said it this way: I bargained with life for a penny, and life would pay no more. However, I begged at evening time when I counted my scanty store. But I discovered that life is a just employer. He gives you what you ask. But once you have set the wages, then you must bear the task. I worked for a menial hire, only to learn dismayed. Whatever price I had asked of life, life would have willingly paid. Thank you so very much. It's been a real pleasure to be here with you, and have a good day. Thank you. Thank you very much.